The ego, defined in psychology as a person's sense of self or identity, plays a significant and multifaceted role in influencing a person's physical, mental, and emotional health. Understanding how the ego operates and its potential impacts is essential for fostering personal well-being and healthier interpersonal relationships. What is the ego? In psychology, particularly in Freudian theory, the ego is one of three components of the personality: ID, ego, superego. The ego acts as the rational part that mediates between the primal desires of the id, the moral constraints of the superego, and the realities of the external world. In broader terms, especially in modern psychology and self-help literature, the ego is often associated with one's self-image, the need for validation, the desire to be right, the fear of being judged or losing control. 2. Influence of ego on mental health. A. Anxiety and stress. Perfectionism and control. A strong ego often resists vulnerability and insists on control and perfection. This can lead to chronic stress and anxiety when reality doesn't meet expectations. Fear of failure or judgment. Ego-driven individuals may fear making mistakes or appearing weak. This fear fuels anxiety and performance pressure. B. Depression. When the ego is wounded, e.g., through rejection, failure, or humiliation, the individual might experience low self-worth, leading to depressive symptoms. A fragile ego, overly reliant on external validation, can cause emotional collapse when approval is not received. C. Narcissism and insecurity. Excessive ego can lead to narcissistic traits: grandiosity, lack of empathy, and a constant need for admiration. Ironically, inflated egos often mask deep insecurity, which can result in unstable emotional well-being and reactive behavior. 3. Influence of ego on emotional health. A. Poor emotional regulation. The ego may suppress emotions considered weak, such as sadness or fear, resulting in emotional repression and psychological tension. Ego-driven people may struggle to admit fault or express vulnerability, hindering emotional maturity and connection. B. Conflict in relationships. A strong ego can lead to defensiveness and blame shifting and inability to empathize, causing friction in personal and professional relationships. Pride and ego often block forgiveness, reconciliation, and genuine connection with others. 4. Influence of ego on physical health. A. Chronic stress. The ego's constant need to prove itself or maintain control can put the body in a prolonged state of stress, fight or flight, increasing cortisol levels. Chronic stress has been linked to weakened immune system, cardiovascular issues, e.g., hypertension, heart disease, gastrointestinal problems, sleep disturbances. B. Neglect of health. Ego can drive people to overwork, ignore rest, or neglect self-care in pursuit of success or image. Some may avoid seeking help for health issues out of pride or fear of appearing vulnerable. 5. Ego and behavioral health. A. Resistance to change. The ego may resist feedback, growth, or change, perceiving them as threats to identity. This can hinder personal development and reinforce unhealthy habits or toxic environments. B. Addictive behaviors. To cope with ego pain or emptiness, individuals may turn to substances, workaholism, or compulsive behaviors for escape or validation. 6. Healthy versus unhealthy ego. 7. Managing the ego for better health. A. Self-awareness. Practices like mindfulness, journaling, and therapy help recognize ego patterns and triggers. B. Humility and acceptance. Accepting imperfections, mistakes, and uncertainties reduces ego tension and boosts emotional resilience. C. Compassion and empathy. Focusing on others' needs and perspectives shifts attention away from ego needs. D. Spiritual or philosophical practices. 1. Understanding egoism. Egoism, in its broadest sense, is the ethical or psychological position that self-interest is the foundation of morality or behavior. Ethical egoism. A philosophical theory suggesting individuals ought to act in their own self-interest. Psychological egoism. A descriptive theory claiming that people always act in their own self-interest, whether consciously or unconsciously. Everyday egoism. In common language, egoism refers to excessive self-focus, selfishness, or a lack of concern for others. 2. Egoism and mental health, dual perspectives. A. Negative impact of egoism on mental health. 1. Social isolation and relationship strain. People who are excessively egoistic often prioritize their own needs at the expense of others. This can lead to conflicts, broken relationships, and social isolation. Poor social connections are strongly linked with depression, anxiety, and lower life satisfaction. 2. Narcissism and personality disorders. Extreme forms of egoism are associated with narcissistic personality traits or disorders. Narcissistic tendencies can lead to fragile self-esteem, dependence on external validation, emotional instability, chronic dissatisfaction, heightened risk of depression or anxiety when faced with failure or rejection. 3. Distorted self-perception. Overemphasis on self can distort an individual's perception of reality. Egoism can cause defensiveness, denial, or inability to take constructive criticism, all of which hinder personal growth and emotional resilience. 4. Moral disengagement. Ethical egoism can sometimes lead to moral disengagement, where individuals justify harmful behavior if it benefits them. This may result in guilt, shame, or cognitive dissonance, which negatively affect mental well-being. B. Positive or adaptive aspects of egoism. 1. Self-preservation and autonomy. A healthy level of egoism, or self-interest, is essential for setting boundaries, making decisions aligned with personal values, protecting oneself from exploitation. This supports self-respect and emotional health. 2. Self-compassion and confidence. Individuals who prioritize their mental health and needs within reason are more likely to engage in self-care, assertiveness, goal-setting, and achievement. This fosters resilience, confidence, and lower stress levels. 3. Motivation and achievement. Ego-driven ambition can fuel personal achievement and growth. As long as it's balanced with empathy and ethics, this can lead to high self-esteem and a strong sense of purpose. 3. The balance, egoism versus altruism. Mental health thrives in balance. Too much egoism, isolation, stress, vulnerability to narcissistic traits. Too much altruism, self-sacrifice, burnout, neglect of personal needs, low self-worth. Psychological models such as self-determination theory emphasize the need for autonomy, relatedness, and competence, all of which require a blend of self-focus and social connectedness. 4th, clinical considerations. Therapists often work with clients on issues related to boundary setting, developing healthy self-interest, reducing narcissistic tendencies in cases of egoism overload, enhancing self-esteem in those who neglect their own needs,